Welcome! We are Valproic acid, and that is our generic name. We have brand names of Depakote, Cyanel, and Belvue. 2-propyl pentanoic acid is our chemical name.
Allow me to discuss our drug classifications. Our therapeutic drug classification is anticonvulsant. Our pharmacologic drug classification is carboxylic acid derivative. Let us proceed to our pregnancy category. Our pregnancy category is category D. Women of childbearing potential should not be started on valproic acid without neurological advice. Adequate counseling should be made available to all women with epilepsy of childbearing potential regarding the risk associated with pregnancy because of the potential teratogenic risk to the fetus. Now let's talk about our mechanism of action. Valproic acid exhibits its pharmacological effects in a couple of ways, such as by acting on E-aminobutyric acid levels in the CNS, blocking voltage-gated ion channels, and also by inhibiting histone deacetylase. Furthermore, the mechanism by which valproate exerts its anti-epileptic effects is not known. However, its anticonvulsant effect may be related, at least in part, to increased brain concentration of the inhibitory neurotransmitter E-aminobutyric acid.
Thank you, partner, for discussing those. Now let's explore our pharmacokinetics. First is our absorption. We are rapidly absorbed from the gastrointestinal tract, having a peak concentration attained after 1 to 2 hours. We are distributed rapidly throughout the body with 80% to 95% protein binding and metabolized by the liver and excreted in the urine.
Thank you, partner. Now let's proceed to our indications and contraindications. But first, indications. I am indicated to be used as a monotherapy or adjunctive therapy in the management of complex partial seizures and simple or complex absence seizures. I am also indicated for prophylaxis of migraine headaches, acute management of mania associated with bipolar disorder. My off-label uses include maintenance therapy for bipolar disorder, treatment for acute bipolar depression, and emergency treatment of status epilepticus. Next, my contraindications. Contraindicated in patients hypersensitive to drug. Use cautiously in patients with history of hepatic dysfunction. Don't give valproate sodium injection to patients with hepatic disease, significant hepatic dysfunction, or acute head trauma. Hyperammonemic encephalopathy, sometimes fatal, has been reported following initiation of valproate therapy in patients with urea cycle disorder, a group of uncommon genetic abnormalities, and particularly ornithine transcarbamylase deficiency. Black box warning. Serious or fetal hepatic failure has been reported during the first 6 months of treatment. Patients below 2 years old is more in danger of hepatic toxicity. There is an increased risk of fatality in anticonvulsant polytherapy. In older patients, hepatotoxicity may present with symptoms of weakness, lethargy, anorexia, facial edema, vomiting, and loss of seizure control. Monitoring symptoms and liver function tests at baseline and then frequently is recommended, particularly during the first 6 months of treatment. The use of valproic acid in patients with mitochondrial disease has been demonstrated to increase the risk of hepatotoxicity and death. Valproic acid should only be used in patients over 2 years old with suspected mitochondrial disorders who have failed to respond to other anticonvulsant treatments, with frequent monitoring of liver function tests and DNA polymerase subunit gamma mutation screening. It can cause life-threatening pancreatitis. Cases of hemorrhagic pancreatitis with rapid progression to death have been reported in all ages regardless of treatment duration. If patients have symptoms of pancreatitis such as nausea, vomiting, abdominal pain, or anorexia, advise them to discontinue the medication and start alternative treatment based on clinical indication. It can cause severe congenital malformations such as neural tube defects and lower IQ scores after in utero exposure. Additionally, in utero exposure to valproic acid correlates with an increased risk of autism spectrum disorders in children. The use of valproic acid in pregnant women for migraine headaches is contraindicated unless there is no other alternative anticonvulsant therapy. According to APA guidelines, additional screening is recommended for women with bipolar disorder who choose to continue taking valproic acid during pregnancy. Now for my side and adverse effect. In the cardiovascular system, we have chest pain and bleeding. In the digestive system, we have nausea, vomiting, diarrhea, and hepatotoxicity. In the endocrine system or lymphatic system, we have drop in body temperature and anaphylaxis. In the muscular system, we have muscle spasm. In the nervous system, we have headache, psychosis, Stevens-Johnson syndrome, hypothermia, encephalopathy, coma, and suicidal thoughts. In the respiratory system, we have rapid breathing. In the skin, we have peeling or blistering skin. In the skeletal system, we have weakness or swelling in the joints. And reproductive system, we have polycystic ovarian syndrome.
When administering us to the patient, here are some special considerations to be taken. First thing is, the nurse must evaluate patients with risk factors associated with UCD before initiation of valproic therapy. Second, we should be administered with food to minimize GI irritation. Third is, valproic acid or AS may cause false positive test results for urinary ketones. Also, we are reportedly alters thyroid function test results. The next thing is the nurse must monitor plasma level and make dosage adjustment as needed. Therapeutic range of drug is 50 to 100 micrograms per milliliter. And watch for tremors because they may indicate need for dosage reduction. Lastly, the nurse must evaluate liver function, platelet count, and PT at baseline and monthly intervals, especially during first 6 months of therapy. That's all. Thank you for listening.